Hello, this is Dr. Bartosh, again at Proactive Wellness and Injury Center, and in this video what I'd like to do is to share with you one of the most accurate means of assessing your current state of health, and it's by using the weight of your body. For many years the gold standard, if you will, was the BMI, the Body Mass Index, which was looking at your height and your weight and coming up with a number that they would determine your state of health by. However, the research is now showing us that people even that have a normal BMI can actually be unhealthy because of some new information that has been revealed. And that has to do with the abdominal body fat, or the fat that is accrued around the abdominal area. Now, in order to assess this, what we do is just a simple thing that you can do at home. It's taking your waist to hip ratio. So what you're going to be doing is measuring your waist and then measuring your hips. Now, you're going to divide the waist by the hip. So we'll just say that a woman has a 30-inch waist and a 29 inches around her hips. So what she's going to do is just divide the 30 divided by the 29, and we come up roughly with 1.034. That's the ratio of the waist to the hips. Now, if the number is 0.8 or above for a female, or 0.95 and above for a male, then it's showing the current state of the body. And that means that this individual, whoever they may be, has a potential for developing or already has developed heart disease, is pre-diabetic or diabetic, or even is leaning toward becoming an individual who is suffering or will suffer from Alzheimer's disease. The amazing thing is that by reducing the body weight, we can actually control the state of our health. And the higher the number, the higher we distance ourselves from 0.8 or 0.95, the more critical or the more dangerous that person's state of health is. Because the abdominal fat, these are commonly called obesogens, they are concentrated. This fat concentration is around very, very important organs, and as that happens, toxins are released in these fat molecules to the organs, which causes them to become diseased and malfunction. One of the most effective things to do then in this situation is to simply lose weight. And I have to tell you, that's the bad news, but the good news is we've been very successful in our endeavor to help patients out in these situations. Number one, because what you'd want to do is to find out what the causative factor is. What's the reason behind this weight gain in this particular area? And then after you've determined that, of course, that will reveal to you the most effective course of action that you can take. And that's what we're all about. And for those of you that might be interested in following this up, feel free to contact our office via the telephone, or if you're outside of our area, we invite you to call our office and set up a time where we can use the computer to have a consult with you and perhaps be able to help you in your action that you would like to take to reduce this from happening to you. So again, remember, if the waist to hip ratio, if your waist is equal to the size of your hips or is larger than your hips, you are on that slippery slope, so to speak, in developing any number of types of heart disease, of diabetes, and or eventually Alzheimer's. And remember this, as I've always said and will continue to say, one of the best and most effective actions you can take in helping to maintain your health is to remain proactive.